This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what is in a steroid injection. If you like this video, we put out new content weekly, so please like and subscribe. So a steroid injection. So maybe you've seen the doctor or someone suggested a steroid injection or someone you know is going to get one, but probably if you're watching this video, there's some question of you possibly getting a steroid injection. So what's in it? So the first thing that's in it is, well, the steroid, the corticosteroid. So there's two main different types of steroids. There's anabolic steroids, which are illegal in most cases, and that's what bodybuilders would take, or people that use performance-enhancing drugs that build a lot of muscle mass. So that's not what this is. So put that out of your mind. It's not going to build any muscle mass. The other is catabolic steroids, which are really strong anti-inflammatories. So that's what corticosteroids are. They're ways of stopping the inflammatory cascade with a really powerful drug. That's a corticosteroid, and there's lots of different names for it. I use Kenalog, but there's multiple different brand names and generic names that come in different strengths and everything like that. So that's one thing that's in there, and that's the main component of a steroid injection is the actual corticosteroid, which is really just a very strong anti-inflammatory. Now, the second component is usually something to help spread the steroid around. So if you need a lot of fluid, you're not going to just fill it with steroid. You usually take a small amount of steroid, then you put something else in it. Most commonly what people use is Lidocaine, which is a numbing agent, almost like they would use in the dentist for your mouth as Novocaine, same sort of family. You can use Marcaine or other sorts of anesthetics. So what that does is twofold. One is it helps spread the steroid around, so when you inject it in a joint, it goes everywhere. And two is it gives some diagnostic ability. So after you give an injection, when the numbing medication is in effect, in most areas, not all areas, but most areas, the person usually should experience some immediate relief. That way you know, A, the diagnosis is correct, most likely, and B, that the injection was placed in the right spot. Or it gives you a higher probability of knowing that. So that's usually the other thing. And usually it's just those two mixed together. Some people will mix saline, some people put just steroids, some people inject lidocaine first, then they inject steroid. I usually just mix them together in one syringe. And just also to note about the steroid is that it looks like liquid, but it's actually in small crystals. So that's also why I use kind of the lidocaine to help kind of smooth that out and spread that around. So anyways, just a fun fact, I guess. But yeah, so to answer your question, what's in a steroid injection? Corticosteroid, not muscle building, really strong anti-inflammatory, combined with an anesthetic. And the steroid usually takes about 2 days to kick in, and the anesthetic usually works right away, then wears off a few hours later. So the normal course is you get a shot, maybe feels really good right away. Next day, you're not really sure, and the day after is when you start getting relief. So I hope I was able to answer your questions about what's in a steroid injection. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you specific medical advice about your specific situation. And again, if you like this video, we put out new content weekly, so please like and subscribe, and thanks for watching.